Respected audience, Assalamu alaikum. I am Professor Shamsuzzaman, Professor of Pathology. I welcome all in today's 30th lecture on pathology. Today, day 2 of shock. Today's topic is septic shock. Dear audience, in day 1 of shock, I have told you what is shock. I have told systemic widespread hypoperfusion of tissue due to disparity between cardiovascular system and blood volume. Gap may threaten life is called shock. And I have told you in day 1 of shock, the end result of shock is hypotension, and in shock there is decreased effective circulating blood volume. End result of shock is hypotension, and there is decreased effective circulating blood volume. As there is decreased effective circulating blood volume, there will be widespread hypoperfusion, then that will lead to shock. Before going to discuss about septic shock, we have to recapitulate bacteremia and septicemia. Now come to what is bacteremia. Bacteremia means presence of bacteria in blood. Is called bacteremia. Presence of bacteria in blood is called bacteremia. Suppose this is the blood vessel, and within the blood vessel this is blood running. If within the blood there is presence of bacteria, this is called bacteremia. Now come to septicemia. Septicemia means bacteremia with multiplication of bacteria is called septicemia. Bacteremia with multiplication of bacteria is called septicemia. Again, bacteremia with multiplication of bacteria is called septicemia. If again this is the blood vessel and this is blood, if these are the bacteria, this is called bacteremia. If bacteria undergo multiplication here and production of so many bacteria there, then this is called septicemia. Now come to septic shock. Septicemia and septic all the same. So shock in septicemia is septic shock. Shock in septicemia is septic shock. Now come to what are the organisms associated with septic shock. Shock in septicemia. Now come to organisms associated with septic shock. The organisms may be most common organisms. The most common organisms are the gram-negative bacillus. These are the gram-negative bacillus. What are the gram-negative bacillus associated with septic shock? One is Escherichia coli, E. coli, Klebsiella, Enterobacter, Pseudomonas, Bacteroid, etc. So, Escherichia coli, Klebsiella, Enterobacter, Pseudomonas, Bacteroid, etc. is the most common gram-negative bacillus associated with the septic shock. Now come to less common organisms associated with septic shock. That are the gram-positive organisms. Like Streptococcus, Pneumococcus. These are the gram-positive organisms associated with septic shock. Dear audience, I have told you in day 1 of shock the mechanism or pathogenesis of hypovolemic shock, pathogenesis of cardiogenic shock, pathogenesis of anaphylactic shock, pathogenesis of neurogenic shock. Now come to pathogenesis, that is mechanism of septic shock. Pathogenesis of septic shock. Again we recall septic shock in septicemia, and the organisms most common gram-negative bacillus and less common gram-positive organisms. The septic shock is caused by these organisms, and the organisms releases toxins. That toxins are associated with the septic shock. Now, the toxins of organisms LPS, lipopolysaccharide, it is released from gram-negative bacillus. Gram-negative bacillus. Another is peptidoglycans. Peptidoglycans, it is released from the gram-positive organism. Dear audience, septic shock commonly occurs by gram-negative bacillus, and this gram-negative bacillus releases toxin lipopolysaccharide LPS, and this LPS is endotoxin, as most of the septic shocks are caused by gram-negative bacillus, and as the gram-negative bacillus releases endotoxin lipopolysaccharide, so septic shock is also called endotoxic shock because LPS is endotoxin. Now come to role of the toxins. Role of the toxins in the steps of septic shock. The toxin acts upon endothelium of blood vessel and causes endothelial injury. Endothelial injury. The toxins acts upon platelets. The toxin acts upon neutrophil or polymorph. The toxin acts upon complement system and activates the complement system. Activates complement system. First come to toxin acts upon endothelium. That is LPS acts upon endothelium. Suppose this is the blood vessel, endothelial lining. The toxin acts upon the endothelium and causes endothelial injury. So endothelial injury, due to endothelial injury, there will be increased vascular permeability. There will be increased vascular permeability. As there is increased vascular permeability, there will be reduction of blood volume. Reduction of blood volume. Then come to toxin acts upon the platelet. Toxin acts upon platelet. Then there will be a release of vasoactive amines. Vasoactive amines from the platelet, and these vasoactive amines act upon endothelium and causes increased vascular permeability. And due to increased vascular permeability, there will be reduction of blood volume. Now come to toxin acts upon the neutrophil. and there will be release of vasoactive amines from the granules of neutrophil. Release of vasoactive amines from the neutrophil, and these amines acts upon the endothelium and causes increased vascular permeability. Acts upon endothelium and causes increased vascular permeability. And due to increased vascular permeability, there will be reduction of blood volume. Now come to the toxin acts upon complement system. Dear audience, you know we have complement system in our body, and the complement system remain as inactive state, and these complements are activated by three pathways. One is classical pathway, one activation by immune complex, it is called classical pathway of activation. When the complement is activated by toxins or by aggregated immunoglobulins, this activation is called alternate pathway of activation. And another pathway of activation is lectin pathway of activation. Here, the toxins of the bacteria, that is the LPS, acts upon the complement system and make it activate. And such type of activation is called, here, this such type of activation is alternate pathway of activation. So, alternate pathway of complement activation. When the complement system is activated, there is production of C3A and C5A. There are other products also. In the septic shock, the product C3A and C5A is associated. What is the role of this C3A and C5A? One of the important role of this complement product is vasodilatation. As vasodilatation, there is pooling of blood. Pooling of blood. As pooling of blood, there will be decreased effective circulating blood volume. Another role of this is increased vascular permeability. And as there is increased vascular permeability by these complement products, there will be decreased blood volume. So these are the role of toxins. It acts upon the endothelium, it acts upon the platelet, upon the neutrophil, and activates the complement by alternate pathway. Respected audience, I have told you in short, there is decreased effective circulating blood volume. So increased vascular permeability due to due to endothelial injury, increased vascular permeability due to vasoactive amines released from platelet, released from neutrophil, and also by the action of C3A and C5A. So endothelial injury leads to increased vascular permeability. Vasoactive amines leads to increased vascular permeability that are released from platelet neutrophil and caused by C3A and C5A. And due to this increased vascular permeability, there is reduction of blood volume, and due to reduction of blood volume, there will be decreased effective circulating blood volume. There will be decreased effective circulating blood volume. Dear audience, you know, due to the role of these toxins, there is also vasodilatation by the C3A and C5A. Vasodilatation due to C3A and C5A, there is pooling of blood, you know, pooling of blood. Due to pooling of blood, there will be decreased cardiac output, and due to decreased cardiac output, there will be decreased effective circulating blood volume. Again, there is decreased effective circulating blood volume. So, this decreased effective circulating blood volume and decreased effective circulating blood volume both are associated with widespread hypoperfusion of tissue. And this widespread hypoperfusion of tissue is associated with shock. So this is the pathogenesis of septic shock briefly. Dear audience, again I want to recapitulate. In septic shock, there is increased vascular permeability due to endothelial injury and by the actions of vasoactive amines. So there is decreased blood volume and decreased effective circulating blood volume. In septic shock, there is vasodilatation, so there is pooling of blood. Due to pooling of blood, there is decreased cardiac output, and that is associated with decreased effective circulating blood volume. And this decreased effective circulating blood volume is associated with widespread hypoperfusion of tissue, and this is nothing but shock in septicemia, so it is septic shock. Now come to morphological changes in tissue in shock. Dear audience, I have told you in the previous lecture, that is in day 1 of shock, there are 3 stages of shock. One is early compensated stage, second one is progressive decompensated stage, and third one is irreversible stage of shock. If anybody goes to irreversible stage of shock, there is morphological changes in tissue. Now come to that point, what are the morphological changes in tissue in shock? Brain. In brain, due to hypoperfusion, there is necrosis, that is liquefaction, necrosis. In lung, damage of alveoli, and there is adult respiratory distress syndrome. Adult respiratory distress syndrome. In the heart, there will be hypoperfusion in the myocardium, there will be ischemic injury, ischemic necrosis, that is myocardial infarction. In the kidney, terodens, you know, if is a kidney, you know, this is the glomerulus. And you know, the tubule is surrounded by blood vessels. If there is hypoperfusion of the tissue, there will be acute tubular necrosis, ATN, acute tubular necrosis. And such type of necrosis in kidney, in septic shock or in shock, it is tubulorectic type of acute tubular necrosis. So these are the important morphological changes in tissue in shock. Respected audience, I have told you there are different types of shock. One is hypovolemic shock, cardiogenic shock, septic shock, etc. Now come to, if a patient comes, what may be the position of the patient with shock, whether patient is given IV fluid or not, what about the extremities, either cold or warm. Position of patient in shock. One is propped up position. Propped up position for the patient suffering from cardiogenic shock. Why propped up position is needed in patient suffering from cardiogenic shock? Dear audience, know in cardiogenic shock there is usually myocardial infarction or endocarditis, and the heart become weak, heart cannot pump properly, there is diminished contractility of the heart. So to avoid overload of heart, the patient is kept in propped up position to reduce venous return from the lower part of the body. Foot end raised position. Foot end raised position is needed for the patient suffering from shock due to hypovolemia or due to septicemia. So in hypovolemic shock and in septic shock, patient is kept as foot end raised position. If in case of hypovolemic shock, the patient is kept as foot in rest position, what will happen? There will be enhancement of venous return from the lower part of the body, and the vital organs, brain, lung, heart, kidney, adrenals get blood. Again, in septic shock, you know there is pooling of blood due to vasodilatation. If in this type of shock, the foot end is raised, there will be venous return from the lower part of the body, and brain, lung, heart, kidney, adrenals will get blood. Now come to IV fluids in shock. IV fluids in shock. IV fluid is contraindicated in cardiogenic shock. Why IV fluid is contraindicated in cardiogenic shock? Dear audience, again, in cardiogenic shock, heart is weak. Heart cannot pump properly. The contractility of the heart is diminished. So, to avoid overload and to avoid pulmonary edema, IV fluid is contraindicated in cardiogenic shock. Rather, diuretics is used in cardiogenic shock. IV fluid is indicated in hypovolemic shock. Dear audience, you know in hypovolemic shock there is reduction of blood volume. To raise the blood volume, IV fluid is indicated in hypovolemic shock. Now come to cold extremities in shock. Cold extremities in shock, dear audience, you know in case of hypovolemic shock, extremities are cold because in hypovolemic shock there is vasoconstriction. Due to vasoconstriction, there is diminished blood in the extremities, so the extremities are cold. But in case of septic shock, the extremities are warm because in septic shock there is vasodilatation, pooling of blood in the extremities, in the peripheral part of the body. So the peripheral part like hand and foot or the legs are warm. Dear audience, this is all about the septic shock. Today up to this, thanks all.